is set for about a half an hour. We'll probably spend between 20 to 30 minutes on the webinar, and then we have 15 minutes planned afterwards for a question and answer session. If you'd like to ask a question during the presentation, you can do so by using the chat feature. All questions that are typed will be viewable by the entire audience and will be answered by one of our panelists. Please note that your phones will be muted during the presentation, but afterwards I can unmute them so you can ask questions. So in our webinar today, it's designed to help users learn how to use the treatment plan module to manage treatment plan procedures and to send and receive pre-authorizations. And after this training, you should be able to know what information can be found in the treatment plan module, know how to customize information displayed in the treatment plan module, understand fees and estimates within the treatment plan module, prioritize treatment, save and edit treatment plans, print, email, and sign treatment plans, create and send pre-authorizations, and receive pre-authorization results. So we'll go ahead and get started with our webinar. I already have my Open Dental here on the treatment plan module, and as you can see, we do have quite a bit of information in the treatment plan module. This is where you're going to come to prioritize treatment that needs to be done, and you can give the patient various options for treatment and manage your pre-authorizations in here. I'm going to start in the upper left corner, and this is where you'll find a list of any saved treatment plans. Right now I don't have any, but later on in the presentation we will save some. To the right of that, you have your show section, and this is where you can change some of the elements that can be shown within the treatment plan. Immediately to the right of that, you have a list of your pre-authorizations. As you move down the screen, you're going to see your grid of treatment plan procedures, and this will include any work that's been entered in the chart module with a status of treatment plan. And the grid will include estimated fees based on the patient's fee schedule and insurance setup, and we'll go over that in a little bit. Next to that, you're going to see your list of priorities to help you prioritize your treatment. And finally, in the lower right corner, you're going to see the family and individual insurance information, which displays family and individual maximums and deductibles, and also shows what benefits have been used and what benefits still remain. So to start with, we're going to go over how to change what information is showing in our treatment plan. I'm going to bring us back up here to this show box and kind of go over some of these options here. The show box you'll use to temporarily change what information is showing in the treatment plan. So we'll start with our first checkbox, the graphical completed treatment. This controls whether or not the graphical tooth chart will display on printed or saved treatment plans. So if that's checked, it will. Unchecked, it won't. Our use insurance maximums and deductibles. This toggles on and off the use of annual maximum and deductibles when calculating estimates. So you'll see down here at the bottom some of my procedures show over the annual max, but maybe I don't want to have that annual max calculated in because I want to see what insurance would pay. So you can toggle that on and off with this checkbox. Our fees toggles on and off all the fees. So if we uncheck this box, we have no fees showing. The insurance estimate will toggle on and off the primary and secondary insurance estimates, and you will be presented with this pop-up whenever you come in here and uncheck this box. And if you check yes, this will turn off. Open Dental will not check to see if the patient has insurance for the rest of your session until you close out of Open Dental. If you check no, the next patient you go to, it will check to see if they have insurance and populate those estimates. And we'll just click that back on. Our discount checkbox will toggle on and off the discount column. And the discount column typically will only show if you have the insurance plan type set as a PPO percentage. So if you're not seeing that discount column, it probably means that your insurance plan type is not set to PPO. The subtotals will turn off this line here showing the subtotals. So when you've prioritized work and you have it arranged in groups, there will be subtotals for each group. If you turn that off, you won't see the subtotals. You'll only see the total at the bottom. And then our totals box. It will turn off the total at the bottom and leave you with only your subtotals. Like I said, these are ways to temporarily change what shows in Open Dental in the treatment plan. If you wanted to permanently change what columns show in this procedures grid, you can do that by going to Setup and Display Fields, and we'll click on the treatment plan module. And in here you have the ability to add columns that aren't currently displaying or remove columns that were displaying but you don't want them to display. So if you didn't want that fee to display, we could remove it. Click OK, and now we don't see the fee column. Now, it is important to note that if you've permanently removed that column, even if you have the checkbox up here to show fees, if you've permanently removed a column, it won't show in Open Dental until you come back into Setup and Display Fields and re-add that column to show. So we'll put this back in here real quick. And you also have the ability to change where the columns display. So I'm going to move our fee column back to where it was before. And I'll click OK. So now that we've gone over how to change what displays in the treatment plan, I want to briefly touch on estimates and the factors that influence estimates in Open Dental. Open Dental's ability to create accurate estimates is really quite powerful, but it does rely on accurate input of various pieces of information into Open Dental. This includes accurately entering the fees for the insurance fee schedule under lists and procedure codes. Also, in selecting the correct plan type and fee schedule or schedules for the plan within the patient's insurance settings. It also requires that you've added proper adjustments to benefits used. If the patient has already used benefits elsewhere, you need to properly set up all of those items so that Open Dental can correctly calculate how much insurance is remaining and what those estimated payments should be. So in the lower right corner of the treatment plan where we saw these annual maxes and deductibles, Open Dental will use all of this information when calculating those estimates. And of note, in this section over here, you will be manually entering the patient's annual max and deductibles into their insurance plan. Open Dental will calculate the rest of these fields: deductible remaining, insurance used, whatever's pending. All of those will be calculated by Open Dental based on what you've done in Open Dental. But for more information on how to properly set up the insurance, the fee schedules, all of those items, you can either call our support group or you can watch our insurance series of webinars that will give you really good information on making sure that that insurance is set up properly. But assuming that the insurance is set up properly, you will find that your estimates will show correctly for the most part in Open Dental. And I just want to go over these columns specifically that show our estimates. So we're going to start with the fee column. And the fee column is either going to populate your office fee or the fee from the insurance fee schedule. And this will depend on what plan type you have set up. So if you have a PPO percentage plan type, you're going to see your office fee in this column. If your plan type is set up as a category percentage, you're going to see the fee from whatever fee schedule you've set for that insurance. The primary insurance column is going to show what the primary insurance is expected to pay. Now, keep that in mind. It's what the insurance is expected to pay, not what the insurance fee schedule allows. So if they pay 80% of their allowed amount, it's going to show what they're going to pay. And same with the secondary insurance column. I don't have a secondary insurance on this patient that we're working with, but if we did, we would see estimates in that column. The discount column, as I mentioned earlier, typically only shows when you have a PPO % plan type selected, and it will show the amount of the expected write-off. So typically the difference between your office fee and what the insurance allows. And finally, the patient estimate column. This is the expected patient portion after any insurance payments and write-offs have been applied. It will also include the deductible. So you'll see on this code here, we have a $50 deductible. That amount is included over here in the patient portion estimate. Furthermore, if you want to see how the estimates were calculated, you can double-click on any procedure in the treatment plan. And in the bottom here, you're going to see the estimate. You can also double-click on this estimate to get even more detailed information about where it's pulling those fees from, what fee schedule is being used for your office fee, for the insurance, the allowed amount from that fee schedule. It's going to give you a breakdown of how it came up with that estimate. So I'll go ahead and close there. And while we're discussing fees and estimates, I would like to take a moment to draw your attention to the toolbar to the Update Fees button. The Update Fees button is designed to be used during the regular 6-month exam if there are procedures from the last exam which have not yet been completed. It's useful if procedures are outdated. For example, if you update your office fees, you can come in and press this button to update the fees. Keep in mind, though, that the Update Fees button here only updates fees for the patient that you're currently working with. If you want to update fees for all patients in Open Dental, we do have a tool that will do that, and you can always give us a call for assistance on how to use that tool. And another situation in which you may need to use the Update Fees button is when a patient's insurance plan or fee schedule has changed since the procedures were treatment planned. So using this Update Fees button will make sure that all procedures for this patient the estimates are being pulled based on the latest information in the patient's account. So now that we've gone over some of the basics of estimates and what information is used to create an estimate, let's go ahead and work on prioritizing a treatment plan. We do have some treatment planned procedures here in our list, and to the right, as I showed you earlier, we have a list of priorities. Now this list can be customized by going to Setup and Definitions, and all the way down on the left, we're going to select Treatment Plan Priorities. And you have the ability to add new priorities in here. You can also edit existing priorities, change the name, change the color. The color on the priorities here represents the color of the text in the treatment plan when you change a procedure to this priority. You also have the ability to hide priorities. If you no longer want to be able to use that priority, you can hide it so that you don't see it anymore. You'll see that priority 9 and 10 have an X in them marked as hidden, which means they won't show up in our list of priorities in the treatment plan. And you also have the ability to change the order in which your priorities display. So if you wanted to move weight up or down, you can just select it, use these up and down keys, and very easily change the order that they display in. And any changes that you make here will immediately be reflected in the treatment plan module. Once we close this, we'll see that now the status of weight has moved up. So setting priorities for procedures is very simple. You can simply select the procedure or procedures, and if your procedures are not right next to each other, like if you wanted to select all of these extractions on tooth 116 and tooth 32, we can use the Control key on our keyboard and hold that down while we select the procedures that we want. Once we've selected the procedures, we simply come over to the list of priorities and click the priority you want to give them. So we'll go ahead and do a couple more here. do all those fillings. And now we've got our treatment plan prioritized. And you could easily change priorities if you decided that you didn't want this filling in with priority 3, you wanted it done later, we could change that to a priority 5. Just clicking on a procedure and clicking on the priority will change it. So now that we've prioritized our work, let's go ahead and save our treatment plan. If you come into the treatment plan and you have no procedures selected and hit the Save Treatment Plan button, this is going to save your entire treatment plan, everything on there. So you'll see now I have a saved treatment plan up here on the left, and it looks exactly the same as my default treatment plan. If you only wanted to save certain procedures into a saved treatment plan, you have the ability to just select those procedures and use the Save Treatment Plan button just like before, but now it will only save those items that you have selected. So once you've saved a treatment plan, it's important to remember the difference between a saved treatment plan and your default treatment plan. Any procedures that are completed or deleted will no longer show in a default treatment plan, but they will continue to show in a saved treatment plan. So if we had completed the work on tooth 1, we had extracted it, we'll go ahead and see if we can set that complete and come back to our treatment plan. Tooth 1 is now no longer in our default treatment plan, but it still remains in our saved treatment plan with an X next to it showing that it's done. So I kind of like to think of a saved treatment plan as a snapshot or a picture of the treatment plan at a given point in time, whereas the default treatment plan is going to be a live version of the treatment plan, and it will change as new treatment is added and as existing treatment is completed. So your default plan will constantly change. Your saved treatment plans will remain the same. So once a treatment plan has been saved, it can be edited. To edit a treatment plan, you can simply double-click on any saved treatment plan. This will bring up the Edit Treatment Plan window, and in here you can change the date of the treatment plan. You can give it a new name. We'll just call this Treatment Plan 1. You also can change the note on the treatment plan. Important to note here that if you change this note in this window, it will only change it for this specific treatment plan. If you want to change the note for all treatment plans, I'll show you in just a bit where we can go and do that. And then if you do have the public health features turned on in Open Dental, you will also see this additional field down here for picking a responsible party. And this just allows you to choose someone other than the patient as responsible for this treatment plan. And as with most windows in Open Dental, clicking the OK button will save any changes that you've made. You also have the ability to delete a saved treatment plan in here if you so choose. But we're going to go ahead and click OK. And now we have our proposed treatment plan number 1. So if you wanted to change that note that we saw at the bottom of our treatment plan there for all treatment plans, you would go to Setup and Modules, and you'd come to the Treatment Plan tab. And in here, you can change the text that will display on treatment plans. Keep in mind that when you change this, it will not change it for already saved treatment plans, but will change it for all treatment plans that you make in the future. Okay, we'll go ahead and close this window. Now, in Open Dental, when you save a treatment plan, you're actually creating copies of the procedure. And because of this, you also have the ability to edit procedures in a saved treatment plan. And to do this, you just click on your treatment plan, and then you can double-click on any procedure listed in your saved treatment plan. In here, you have the ability to make changes to the procedure. We can change the description. You can change the fees. You can add a discount, change the discount. You can change around anything you want. And once you click OK, this will save the changes that you made, but it will only save them in that saved treatment plan. So if we go back to our default treatment plan and we look at tooth 16, the extraction, it still has the same description as it always did. So with a saved treatment plan, you have the ability to change those procedures. Once your treatment plan, your saved treatment plan looks the way that you want it, you have various things that you can do with it in Open Dental. We have our toolbar at the top. You have the ability to print a treatment plan. You have the ability to email a treatment plan directly to the patient if you have email set up in Open Dental and your patient has an email address entered into Open Dental. When you click the email button, Open Dental will generate an email to the patient with the treatment plan already attached. All you need to do is type in your message and hit send. Finally, you can also allow your patient to sign a treatment plan. So if you have a Topaz signature pad, if you have a tablet with a stylus, or even a mouse, the patient would have the ability to sign this treatment plan. Once we click OK, we'll see that this treatment plan now has an X in the signed column showing that it has been accepted. Now, it's worth noting that some treatment plan edits will invalidate a signature. So if you've already had that patient sign and you made changes to the treatment plan, the patient would then have to re-sign to re-accept that. And the changes that will do this are editing the treatment plan date or the note, or editing the procedure code's description like we did here. If we did that after the patient had signed, we would have to have them re-sign. We're going to move back to our default treatment plan, and I want to briefly go over pre-authorizations in Open Dental. In Open Dental, pre-authorizations are very simple to do. All you need to do is select the procedure or procedures that you want to get a pre-authorization for. So if we needed to get a pre-authorization for these two extractions, we could select them. And remember, if the procedures aren't right next to each other, hold the Control key down on your keyboard and use the mouse to click on each procedure that you want. And once you've highlighted your procedures, just click the pre-authorization button up on the toolbar. In here, you will be asked to choose or highlight the patient's insurance and their relationship to the subscriber, and you'll click OK. Your pre-auth is now created. From here, you have the ability to print this pre-authorization to mail in. You have the ability to click the send button and send it immediately. Or you can click OK. Right now the status is waiting to send. If we click OK, that will hold this pre-authorization to be batched and sent at the end of the day with any of your other claims that you may have. We'll go ahead and change our status to sent here for the sake of our webinar and click OK. And now in the upper right corner of the treatment plan module, you're going to see your list of pre-authorizations. Your status column will have either an S for sent, a W for waiting to send, or an R if it's been received. After you've sent your pre-authorization and you've gotten the results back, you will come back to your treatment plan module and you will simply double-click on the pre-authorization in the upper right corner. You will use the By Procedure button in the upper right of this pre-authorization, and you will be able to enter how much the insurance has told you that they are going to pay. And we'll just say that they're going to pay $120 on each of those. We also recommend in the remarks column putting in the pre-authorization number and or any comments that you have received on the pre-authorization. If they're not going to cover it, you can put the remarks in here as to why so that you have that recorded. And putting the pre-authorization number into the remarks section simply makes it easier when you've finally completed this procedure and you have created your final claim and you're getting ready to send it. You'll want to put that authorization number into the predetermined benefits field of the claim. And if you have that auth number already in this remarks section, it will be showing within the claim for you to easily put in there, and you don't have to refer back to the original EOB that you received back on this pre-authorization. And once you click OK, these estimates that you entered will now show for your treatment planned procedure. So we'll see now that the insurance is expected to pay $120 on each of these procedures. And this concludes the